Good afternoon, and welcome to the National Prevention Week 2019 webinar series. Thank you for joining us. Today's webinar is being recorded. At this time, I would like to turn the webinar over to our moderator, David Lamont Wilson from SAMHSA. Please go ahead, David.
Welcome, everyone. I am David Lamont Wilson. I'm a public health analyst at the Substance Abuse and Mental Health Services Administration Center for Substance Abuse Prevention, or CSAP. And I'm also the coordinator for SAMHSA's National Prevention Week initiative. I will be the moderator for today's webinar. Today's discussion will cover a disturbing trend that has emerged over the past several years. E-cigarettes are now the most commonly used form of tobacco among youth in the U.S. Our panel of distinguished presenters will be discussing this trend and key strategies for preventing e-cigarettes among youth. Prevention approaches for youth e-cigarette use must be varied, and they must take place at multiple levels and include multiple sectors. We will be examining the latest data trends, effective prevention strategies, and approaches from the field that can inform our own work in preventing teen e-cigarette use. But before we begin, I would like to make a few housekeeping announcements. One, please use the chat pod to send us your thoughts and questions throughout each speaker's presentation. There will be a Q&A session period following all of the speaker presentations, and I will pose your questions to our panel at that time. Two, this webinar is being recorded and will be available on SAMHSA's YouTube page. So if you have colleagues or coalition partners who weren't able to join us today, they can access it on demand when it is available. And lastly, we will make the slide presentations available after the webinar, so you'll have the information and the resources that we discussed today at your fingertips. And you can share the data and the resources and the strategies that we've discussed with your colleagues and your partners. Now, I would love to introduce our four exciting presenters. Starting our conversation today will be Dr. Brian King from CDC's Office on Smoking and Health. Then we will hear from my SAMHSA colleague from the Center for Substance Abuse Prevention, Mr. John O'Donnell. We will also hear from Donna Vallone, who leads the Truth Initiative's research efforts. And from FDA, we will be joined by Emily Diorio, who works on the Real Cost campaign. But before we begin our presentations, I'd like to take just a few moments to talk about the reason why we're here, which is National Prevention Week. This webinar series is one of the many resources, activities, and events available to you through NPW. And I'd like to highlight just a few for you to explore following the webinar. Now, each year, SAMHSA selects a theme for National Prevention Week, and the theme for this year is Inspiring Action, Changing Lives. This theme reminds us that we can all inspire positive change throughout the year. Every day and everywhere, whether you make healthy choices for ourselves or inspire others to do so, the small actions we take can change lives for the better. Now, as you may know, NPW is an annual observance dedicated to increasing awareness of substance use and mental health issues. And the NPW initiative focuses its activities, events, and resources on progress in these three main goal areas. Capturing your success and knowing what works for you are important for NPW this year. Now, we know that organizations and coalitions and communities are doing great work in the field, and SAMHSA wants to hear about it. We want to know about this great work. So start planning your prevention activities today, track your progress and your growth, measure your reach and your impact, then share your successes and your progress with us. Perhaps we will feature your organization, your coalition, or your community in an upcoming webinar. So visit the NPW website to connect with us. Now, each day during National Prevention Week in May, we focus on different pressing health themes, and we encourage you and your communities to discuss various aspects of prevention. Communities across the country host health fairs, town hall meetings, trainings, Twitter chats, and other National Prevention Week activities and events to contribute to our growing conversation around this thing called prevention. Now, before we start with today's webinar, we want to ask everyone to share one prevention leader whose work has influenced you. Well, during this year's NPW, we're challenging each of you to spread the word about those leaders who have influenced you. We're calling these leaders prevention champions. Now, a prevention champion is a person, an activity, a program, or an organization that inspires others to take prevention actions every day that change lives. Now, whether it's an organization that you've worked with, a program that you've read about, or a person in your community who is motivating others to take prevention actions, we want to hear about that. So through our NPW 2019 Prevention Champion, we want to learn who your prevention champions are. So participating in the challenge is easy, and we hope that you have some fun joining and learning about other prevention champions. We can take part in the challenge, and you can take part in the challenge by sharing a photo or a video of your champion and adding one word that you feel best describes them. Then you can share your photo or your video and the word on social media using the hashtags Prevention Champion and NPW 2019. Now, I have already taken part in the challenge, and my leader, who we work with, who I think is a great inspiration to me, is General Arthur Dean, the longtime CEO of the Community Anti-Drug Coalitions of America, or CADCA, and my word for him is determination, because I admire how General Dean has remained dedicated to CADCA's vision of safe and healthy and drug-free communities. Now, another prevention champion that inspires us is Pacific Institute for Research and Evaluation, or PIRE. And that prevention word, or that challenge word for that organization for us, is groundbreaking. Now, PIRE developed and disseminated some of the earliest prevention strategies, which were currently and certainly groundbreaking. Now, those are just two prevention champions that inspire me and us. Now, we plan to continue spotlighting more prevention champions throughout NPW 2019, and we look forward to learning about your prevention champions. So, in addition to taking the Prevention Champion Challenge, you can also get involved in NPW by visiting samhsa.gov/Prevention Week for the latest prevention resources, by planning prevention activities and events in your community, and by sharing information on social media using the hashtag NPW 2019. Now, I certainly hope that you are as excited about NPW 2019 as I am. And as I always say, prevention should happen every day, and everyone has a role to play in making our communities healthier. I will once again say that National Prevention Week is the culmination and the amplification of your prevention activities that are taking place every day, year-round. So, that's my National Prevention Week spiel. Now I want to get to the real meat of why we're all here today. So kicking off our presentation today is Dr. Brian A. King from the Centers for Disease Control. Now, Dr. King is the Deputy Director for Research Translation in the Office on Smoking and Health within the National Center for Chronic Disease Prevention and Health Promotion. He is responsible for providing scientific leadership, and technical expertise to CDC. And before we begin discussing effective approaches for addressing teen e-cigarette use, Dr. King will set the stage for us by sharing current data trends. Now, Dr. King has worked for more than a decade to provide sound scientific evidence to inform tobacco control policy and to effectively communicate this information to key stakeholders, including decision makers, the media, and the general public. He has authored or co-authored more than 100 peer-reviewed scientific articles pertaining to tobacco prevention and control. So without any further ado, please join us in welcoming Dr. Brian A. King.
Thank you very much, David. I appreciate the introduction. It's my pleasure to be here today to talk about an issue that is of increasing importance to us here at the CDC, specifically the issue of e-cigarette use among youth and young adults. So to get us started off today, I just want to acknowledge that the tobacco product landscape is evolving, and I like to remind people that we are in the business of tobacco prevention and control, not just cigarette prevention and control. And when it comes to tobacco control, we don't want to be playing a game of public health whack-a-mole, where we allow certain products to go up and others to go down. And our ultimate end game when it comes to youth is that any form of tobacco product use is unsafe, irrespective of whether it's smoked, smokeless, or electronic. And so you can see here from this image that there's a lot of different tobacco products that are out there that kids are using. But within the past decade, we've seen a surge in the use of emerging products, particularly electronic products or e-cigarettes, which are noted at the bottom there. And that's going to be the focus of our discussion today. And we're also seeing a diversification of the types of products that are included within that e-cigarette landscape. We know that there's a variety of different terms that people are using for these products, whether it be vape pens or e-hookah or e-cigarettes. But we do know that in the past couple years, there's been a surge of a specific product called Juul. And in case you haven't lived in a cave within the past few years, I'm sure you've heard of this device, which has run amok across our nation's schools. We've received anecdotal reports nationally of them being used in classrooms in the middle of sessions, but also within bathrooms and other areas of school grounds. And so this is certainly an increasingly problematic issue for us here in the United States. But for the most part, these products are basically function the same as typical e-cigarettes in that they produce an aerosol, which can contain potentially harmful ingredients. But they're unique in that they have a very discrete shape and are shaped like a USB flash drive, which allows them to be used by youth relatively unconcealed. And they also come in a variety of different flavors and have high nicotine content, which we're going to discuss more later. But if imitation is the greatest form of flattery, then our friends over at Juul are probably quite flattered, I suspect, in that there's a variety of different people who are now knocking off these products, including several in big tobacco, including Altria, Imperial Tobacco, as well as R.J. Reynolds, as you can see up on the top, but also several other folks who are now entering this marketplace that have not previously sold conventional cigarettes or other products. And of note, there's also newer types of products such as Sworn Drop or Sworn Air that aren't necessarily using that USB flash drive device shape, but they're still an e-cigarette product. And the broader term that we're hearing these being called is pod mods, because they use individual pods that the youth can replace into the individual device. And that also goes for the Juul products as well. And these are what we call the fourth generation of e-cigarettes. They've gone over an evolution over the past 10 years since e-cigarettes entered the United States in 2007, with the first generation being the disposable small varieties that resemble cigarettes, the second generation being the refillable rechargeable devices, the third generation being the larger tank systems that you would see at a vape shop or a more experienced user using. And then finally, this fourth generation has arrived. The great-grandbabies are here. The Pod Mod and Juul are the next phase of this continuing evolution of the e-cigarette landscape. And of course, we know that the products are entering the marketplace, but they're also being used. And these data were reported from the CDC and FDA this past November, and then were released in more nuance for other products just last month. And we saw a skyrocketing, unprecedented increase, a 78% increase in e-cigarette use among high school students within the past year alone. And this is simply unprecedented, the highest year-over-year increase that we've seen for any substance in the past 40 years. years, according to the Monitoring the Future survey that mirrored the findings we saw in the National Youth Tobacco Survey. So presently we have 21% of our nation's youth who are current users of e-cigarettes, and compare that to adults where it's 2.8%. So nearly a tenfold higher rate of use among youth, and that's why we have what the Surgeon General has called an epidemic among our nation's youth when it comes to e-cigarettes. So you may ask, well, why are we seeing that? And here's the line I'm going to share, folks. The advertising will lead a horse to water, the flavors will get them to drink, and the nicotine keeps them coming back for more. And this is the trifecta of ingredients that are influencing the increasing rates of use that we're seeing among our nation's youth. And this should be no surprise because these are the same factors that influenced youth use of conventional cigarettes over the past several decades. And so it's the same story but a different book, and we're seeing this continued evolution of the landscape and using those same strategies that the industry knows work. Okay, they don't need to fix something that's not broken, and we know that 8 in 10 U.S. youth are exposed to advertising. 85% of e-cigarette youth users are using flavored products, and it's the primary reason they report using e-cigarettes. And we also know that the nicotine in these products is very high and also extremely addictive. And nicotine is not safe for kids for a variety of reasons that we're going to talk about in a bit. So when it comes to e-cigarettes, we frequently get into this discussion over the potential benefits and the potential risks, and people acknowledging that, while these could help certain people, particularly adults, and the bottom line is that in order for these products to have a net public health benefit, the benefits have to outweigh the risks. And so although an adult smoker could benefit from these products, if they were to transition completely from regular cigarettes to e-cigarettes, that type of argument only holds muster when we're talking about adults. And we still don't have enough science to say that e-cigarettes are effective to help people quit, although the science continues to emerge. But when it comes to youth, we follow what we call the precautionary principle. And the bottom line there is that any form of tobacco product use, including e-cigarettes, is unsafe for them. And there's a lot of other health risks at the population level that we need to consider when it comes to these products. One of the first and foremost is the concerns over the gateway issue. There's a growing body of science showing that kids who use e-cigarettes are significantly more likely to smoke regular cigarettes in the future. There's also concerns over exposure to secondhand aerosol to these products, which is why a dozen states and several hundred communities across the country have included e-cigarettes in their smoke-free air laws. We do know it's an aerosol. It is not a harmless water vapor, which is not safe for kids to be inhaling. There's also concerns over glamorization or renormalization of tobacco in the media, including by celebrities such as Jenny McCarthy, who I wouldn't consider to be a pillar of public health advocacy on multiple fronts. And finally, there's also concerns over poisoning of these products. We see about 4,000 calls per year with regard to calls to poison control centers, and about 50% of those are for kids 5 years of age or younger. So a variety of concerns over these products. But going back to youth use of these products, nicotine in particular is problematic. And the 2016 U.S. Surgeon General's report concluded that nicotine exposure during adolescence can cause addiction and can harm the developing adolescent brain. Okay, this is very important because we know that the brain continues to develop until young adulthood, about age 25. So this also goes for youth and young adults. And this is a time when they're still developing synapses in their brain, and things are firing a lot quicker than adults. So they're particularly vulnerable to assaults from external substances. And nicotine in particular can harm the parts of the brain that are responsible for learning, cognition, and memory. And so it's critical that kids don't use any form of tobacco product that contains nicotine or any tobacco product whatsoever, and the same holds for e-cigarettes. But we know that with the resurgence of newer type of e-cigarettes, including Juul, that there's also another factor, the type of nicotine in these products. And Juul is unique in that they use nicotine salts. And so if you go back to your high school chemistry class, remember when you were looking at the litmus test on acids or bases. And so most tobacco products use nicotine that's called free-base nicotine. So it's very basic, very blue. And that means that it's very volatile and it's crazy, which means it's going to be very hoarse on your throat. And so you can only deliver a certain level of nicotine with current cigarettes as well as current e-cigarettes because the levels would be so high that people wouldn't be able to bear it. So what did Juul do? Well, they added something called benzoic acid to the nicotine, which reduced it and made it more acidic, and that makes what we call nicotine salts. And so the nicotine salts are going to go down a lot easier, and they're not going to be as harsh on your throat, which means you can deliver higher rates of nicotine in an easier fashion. And who is that a concern for? Youth and young adults, nicotine-naive populations who have not previously been exposed to nicotine. And that's why Juul in particular, in coordination with this discreet shape and the heavy advertising on social media and elsewhere, but the use of nicotine salts can make it even more concerning in terms of addiction and dependency among kids. But that's not all that people are using in e-cigarettes. We know that a third of youth e-cigarette users who have ever used these products report that they've used marijuana in these devices. And that is also consistent with the findings of a Surgeon General's report back in 2016, which concluded that these products can be used to accommodate other psychoactive substances. So in addition to nicotine, we also know there's prominent use of other products, including marijuana in these devices. And we also know that they're being used with a variety of different flavors as well. And that's concerning because although these flavors may be approved as generally recognized as safe by the FDA for ingestion, that doesn't mean they're safe to inhale. And the gut was designed to handle a lot more than your lungs. And the gut also has an exit strategy. And so inhaling some of these flavorings deep into the lungs, it's concerning to us because we don't know what those long-term implications are, particularly for youth and young adults. And so the bottom line is, well, we know all these risks, but what can we do about it? And that's critical as a public health community, particularly for tobacco control. It's very easy to pontificate from our perch, but we have to tell people what can you do to solve the situation. And so late last year, the U.S. Surgeon General called this issue an epidemic and released a Surgeon General's advisory, which was only the fifth within the past 20 years and the first ever on a tobacco-related issue, which underscores the severity of this issue. And you can access it at the URL there, and it acknowledged various entities that can take action, including parents, educators, health professionals, as well as states and communities. And we ultimately know what works. We don't need to reinvent the wheel. We just need to modernize our strategies so that it's including the diversity of tobacco products that kids are using. And we also have coordinated efforts at the federal and state level. And so we know that the FDA has authority to regulate tobacco products, including e-cigarettes, but a key component of the regulatory authority they have is that it doesn't stop states and communities from acting as well. And so there's a lot of things that can happen at the subnational level, including e-cigarettes and smoke-free air policies, restricting youth access, licensing retailers, increasing the age of tobacco to 21, implementing pricing strategies to make these products more costly for kids so they can't access them, and also prohibiting the sale of flavored tobacco products given the influence of these flavors in youth e-cigarette use. And so all these factors in coordination with parents and educators, making sure that they know the types of products that kids are using, they can identify Juul, they communicate those risks to kids, and they make sure that they get evidence-based resources to not only prevent them from starting in the first place, but also from quitting. And so I'll just end with a brief summary of everything. So if I put you to sleep, rise from your slumber, and get these key take-home messages. We know that e-cigarettes are a tobacco product that produces an aerosol that includes nicotine, flavorings, and other chemicals. It does not produce a harmless water vapor. Remember that the advertising will bring a horse to water, the flavors get them to drink, and the nicotine will keep them coming back for more. E-cigarette use has reached epidemic proportions among our nation's youth, nearly 10-fold higher than adults. And the bottom line here is that youth use of any tobacco product, including e-cigarettes, is unsafe. And when it comes to what we can do about it, we don't need to reinvent the wheel, folks. As the tobacco product landscape continues to diversify, so must we, and it's critical that our strategies modernize to keep pace with the changing landscape. And with that, I'll close with my contact information and some key resources from CDC, including cdc.gov/tobacco, including a variety of really useful infographics and resources that are available online, including through social media about e-cigarettes more broadly, but also specifically to Juul, including some parent and healthcare provider cards with commonly asked questions and ways that you can talk to youth about this issue and ensure that we prevent having a tobacco and nicotine addicted generation to come. So thank you for your time, folks.
And thank you, Dr. King, for not only helping us kind of better understand the new data trends around e-cigarette use, but also thank you for sharing the practices that CDC is recommending for addressing e-cigarette use. Now, as we all know, the collection of data around this emerging trend has been crucial for responding to this shift in youth nicotine use, and it's helping to inform action. So next, my CSAP colleague, John O'Donnell, will share more about SAMHSA's approach. Now, John is a public health advisor in the Substance Abuse and Mental Health Services Administration's CSAP. He has worked there for more than 20 years in the field of public health and substance abuse prevention and treatment. And since March of 2017, he has served as CSAP's acting Synar lead. Now, in this role, he is responsible for oversight of the Synar regulatory program, which promotes child, adolescent, and adult health by requiring the 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands and 6 Pacific jurisdictions to enact and enforce laws restricting youth access to tobacco products. So welcome, John.
Thanks very much, David, and good afternoon, everybody. As David indicated, I'll be speaking to you about the Synar Youth Tobacco Access Prevention Program and its connection to preventing teen use of e-cigarettes, or more broadly, electronic nicotine delivery systems, or ENDS. I'll start off by giving some background on the Synar program, including its link to the Federal Substance Abuse Prevention and Treatment Block Grant. After that, I'll discuss the relevance of the Synar program to addressing teen use of ENDS products, and I'll close with some ways that communities can work with state Synar programs to prevent youth access to tobacco products, including e-cigarettes. So, understanding the Synar program requires us first to briefly describe the agency that administers it, that is SAMHSA. Besides being where I work, SAMHSA is the agency within HHS that leads public health efforts to advance the nation's behavioral health. To accomplish this, one of SAMHSA's key roles is to fund grants to develop service capacity. A major example of this is the Substance Abuse Prevention and Treatment Block Grant, or SABG, which is awarded every year to all states, U.S. territories, Pacific jurisdictions, and one tribal entity. The SABG relates to the Synar Youth Tobacco Access Prevention Program in a number of ways. For example, states may use block grant funds to support certain Synar activities. Also, penalties for noncompliance with Synar requirements can affect a state's SABG award. Well, the rationale for tobacco control and prevention efforts, like the Synar program, is neatly summarized in this statement from the CDC. That is, that tobacco use is the leading preventable cause of death in the U.S. In fact, the most commonly used form of tobacco, traditional cigarettes, causes about 1 of every 5 deaths in our country each year. And the data in this slide make the case even more clearly. Between 2010 and 2014, smoking was responsible for approximately 480,000 premature deaths every year among Americans 35 and older, and smoking was responsible for nearly 90% of all lung cancer deaths, 61% of all pulmonary deaths, and for 32% of all coronary deaths in this country. And we know that tobacco use begins as a pediatric issue. 88% of adult daily smokers report that they first smoked by age 18, and 99% report first smoking by age 26. Also, more than one-third smoke their first cigarette by the age of 14. We also know that the younger a person is when they start smoking, the more likely they are to become nicotine dependent. In fact, 80% of nicotine-dependent adults report that they started smoking before age 18. These data suggest that if people are prevented from smoking or using tobacco while they are young, they will be unlikely to ever begin using tobacco. And this is the central premise of the Synar legislation, which reflects former Congressman Michael Synar's vision for reducing youth access to tobacco products. The Synar Amendment and its implementing regulation require states to enact and enforce, as David said, laws prohibiting the sale and distribution of tobacco products to individuals under the age of 18. As SAMHSA sees it, reducing access to tobacco products through retail sources is one component of a comprehensive, multi-level, multi-sector tobacco control and prevention program, in David's words. And we believe that that includes the variety of federal, state, and local actions that Dr. King talked about just a few minutes ago. Next, we have some history and detail on the Synar statute and regulation, and I would just highlight a few requirements of the Synar program. First, states must enforce their youth tobacco access laws. They must also conduct yearly random unannounced inspections of outlets that minors can access. These inspections serve as an annual survey indicating the rate at which the state's law is violated, that is, when a minor is able to purchase a tobacco product. Also, the violation rate, as indicated by the results of that yearly state survey, must not exceed 20%. Finally, states must submit an annual Synar report to SAMHSA. Now, as for penalties for noncompliance with these requirements, states receiving more than $1 million in SABG funds that do not comply with the Synar requirements are subject to a penalty of 40% of their SABG funding. There is an alternative penalty which allows non-compliant states to afford the 40% cut if the state agrees to spend its own funds to improve compliance with the law. However, this alternative penalty, which can still cost the state millions of dollars, only applies to noncompliance with the 20% maximum violation rate requirement. A state that, for example, fails to enforce its law would be subject to the 40% cut, and you can all imagine what that would do to your state's prevention and treatment system. So compliance is crucial. Well, based on the data on state violation rates and youth tobacco prevalence rates over time, it's fair to say that Synar has been a critical component of the success of comprehensive youth tobacco prevention and control efforts over the last 20 years. One indication of that success is that while the weighted national average violation rate for states was 40.1% in fiscal 1997, the rate has plummeted since then to just 9.6% in fiscal 2018. So, how does the Synar program relate to the prevention of youth e-cigarette use? Well, first, states may propose to revise their Synar inspection protocols to include attempted buys of electronic products if such products are defined as tobacco products in state law. And SAMHSA does not presume to interpret state laws, so it is entirely up to the state itself to interpret its state law. And when this question comes up, we advise states to consult their state attorneys general. I can tell you that also as of federal fiscal year 2018, 19 states have added electronic products to their protocols as products that can be requested during Synar inspections. I should also point out that states that include electronic products in their Synar inspections decide how often those products will actually be requested by inspectors unless the Synar checks are combined with FDA tobacco inspections. When Synar and FDA tobacco inspections are combined, the FDA protocol, including any requirements on the products to be requested, must be followed. So the fact that 19 states now include electronic products like e-cigarettes among the products that could be requested in Synar checks could potentially lead us to some useful data on such issues as the level of compliance with state laws prohibiting youth retail access to electronic products. But please keep in mind a few disclaimers. First, merely comparing violation rates in states that did and did not include electronics among products that might be requested by Synar inspections can be misleading. Knowing that a state is including electronic products among the products that might be requested doesn't tell you how often those products were actually requested or whether attempted purchases of those products were more or less likely to produce violations than attempted buys of other products. States might be able to detect possible data trends within their states, however, now using a new feature in the Synar Survey Estimation System, or SSES, this new feature tabulates optional data reported by the state on product choice in the inspections. However, this feature is brand new having first been made available to states for the fiscal 2019 annual Synar report. Also, any state-by-state comparisons that SAMHSA might be able to make would be limited to states reporting on product choice, the product choice data, which are optional rather than required. And finally, even with more detailed, complete data spanning multiple years, we need to remember that many variables besides product choice might be associated with violation rates. For example, levels of enforcement. Well, finally, I'd like to say a bit about how communities, which are well represented on the phone I know, can help their state Synar programs to prevent youth access to tobacco products, including electronic products, depending on the state that you are in. One way to start is to know who your state's Synar coordinator is. Every state government has one. If you don't know and can't find out from your state's website, just email me or give me a call. My contact information is at the end of the slides. You can also learn about and comment on your state's annual Synar report, or ASR. States are required to make their ASRs available to the public for review and comment. And this can be done in various ways, such as posting on a state website, dissemination at public meetings, distribution at public libraries, and other means. If your state's ASR is posted on a state website, you might be able to find it most easily by doing an internet search of your state's name and the words Annual Synar Report. I'd also encourage you to find out who recruits and trains Synar youth inspectors in your state and how to get youth in your community involved. Your state Synar coordinator can tell you about this. Youth inspectors work with adult inspectors to conduct Synar survey inspections in which the youth attempt to purchase tobacco products, which, depending on your state, may include electronic products such as e-cigarettes. These youth are typically ages 15 through 17, though some states also use youth up to age 20 as inspectors. Brian mentioned the trend toward tobacco 21 in some states, and this is a kind of a reflection of that. One benefit of participation by youth is that serving as an inspector may fulfill high school community services requirements. Also, because adult inspectors are often law enforcement officers, working in the Synar program can be a great opportunity for youth who are interested in careers in law enforcement, as well as for those who are interested in careers in the field of substance abuse prevention. Finally, participation is one way to empower young people with both knowledge and experience in confronting tobacco issues, including issues involving electronic products. Community members of any age could also potentially help with other aspects of their state's Synar program, including community mobilization, public education, and merchant education efforts. And last of all, why does Synar matter to communities like yours? Well, I would say in answer to that question that one reason lies in the large penalties that states can incur for Synar noncompliance, which I mentioned earlier. But more importantly, Synar matters because of the consequences of early adoption of tobacco use, including the use of e-cigarettes for the young people in your communities. Well, thank you very much for listening. I've got my contact information up there. Please take me up on my offer if there's any way I can be of assistance to you, but thank you for your attention.
Thank you so much, John. Thank you for not only sharing SAMHSA's perspective on this issue, but helping us understand Synar just a little bit better. Now I'd like to shift our focus to a non-governmental organization that's addressing teen e-cigarette use. The Truth Initiative is America's largest nonprofit public health organization, and they are dedicated to making tobacco use a thing of the past. We will hear today about prevention strategies that they're putting into action right now. Now, Dr. Donna Vallone serves as the Chief Research Officer at Truth Initiative's, I think I'm saying this right, Schroeder Institute, and she holds an associate professor's appointment at the College of Global Public Health at New York University. Dr. Vallone leads a multidisciplinary team of more than 30 research staff focused on examining the influence of health communication and tobacco policy initiatives to reduce tobacco use among youth and youth adults. Now, most notably, Dr. Vallone leads the evaluation of the National Youth Smoking Prevention Truth Campaign. And her research focuses on examining the influence of media messages on reducing tobacco use, particularly among lower socioeconomic status and racial and ethnically minority groups. Now, I am so pleased to welcome Dr. Donna Vallone from the Truth Initiative.
Thank you so much, David, and hello to everyone. It's a pleasure to be here today. As David mentioned, the National Truth Campaign has been in existence over, amazingly, 2 decades, and most of its messages were primarily focused on issues related to combustible tobacco. Within the last year and a half, as this emerging epidemic of e-cigarette and vape use has really just a meteoric rise in use, we've spent a considerable amount of time conducting research to really understand how best to speak to kids about this topic. As many of you know, the campaign goal is to air and develop mass media messages which really counter industry and marketing promotional efforts. And that's really to help denormalize and deglamorize tobacco. Today, I'm really going to be focusing on walking you through the formative research we've conducted at Truth to address e-cigarette use, with a particular focus on Juul, which Brian King has already talked about. Given that Juul now holds over a 75% market share within the e-cigarette category, this is the e-cigarette category leader. I'll also provide some of the insights into developing messaging strategies for this vulnerable group. And then I'll just touch on a new program that we've developed to help youth and young adults quit e-cigarettes. So let me just jump right in. We've conducted a variety of different studies using in-home interviews, and that's where literally we go into the bedrooms of youth and young adults, usually with friendship pairs, to really try and understand what's happening for youth, what music are they listening to, who are they following, what's important in their life, and what is the role of tobacco within that broad sphere. We also conducted focus groups across the nation with both young adults and teens. And we also ask our youth and young adults to speak to us through mobile chat, as well as participants often like to videotape themselves, giving us information about broad subjects related to their passion points and how they are using these products. So let me just give you a brief synopsis of what our young people told us. They're introduced to juuling through friends, and they really think of Juul as synonymous with e-cigarettes, but I'll get into that in a minute about how the monikers that we use and that youth and young adults use to describe these different behaviors and products may differ depending on the segment. As Brian mentioned, Juuls are ubiquitous. They are in schools, they are at playgrounds, they are in many, many places that youth and young adults frequent. And they can act as what we call a social lubricant. They offer flavors, and many kids are involved in what we call smoke tricks as very appealing sort of activities to engage in when you're juuling. And Juul users often split into those that actually own a device and share it with others, and those that don't own a device, but they use other devices, others' Juuls. And they don't often perceive the risks of vaping that may outweigh the benefits. So let me go a little bit deeper. As I said, friends are usually the point of entry for most Juulers. Sharing is extremely, extremely common. A barrier to actually owning a Juul is cost. and you can imagine that teens and young adults are extremely price sensitive. They also have very different perceptions of what being addicted to it really means. For many teens and young adults, only Juul is really the most appealing device. They report that other e-cigs or vapes are often used by heavy users or older people that are nicotine addicted. And so here I feature a tweet by someone who actually, Lorena, says, for all the real smokers, I need to quit. I know vaping isn't any better, but I need something, so my question is vape or Juul. And here you can see that's really a disconnect between vaping, quote unquote, and juuling. So I think that's really an important issue when you're speaking to youth and young adults, to make clear about the product you're speaking about, since they often think of these things as two different things. As I said, Juuls are everywhere. They're not just at parties, but they're in school, as Brian mentioned, in school lavatories, and then when hanging out with friends. They're often what we call a social lubricant. What does that mean? Kids told us that they're a conversation starter, something to hold besides a drink when you're at a social activity, or holding your phone at parties. As was mentioned, the flavors are extremely appealing. Mango is one of the most widely used flavors, and they don't perceive the risks of vaping. I think what's really important to mention here is that many of the insights that we found about these products are very similar to the insights we uncovered 20 years ago when we talked to kids about cigarettes. They use it as a device to strike up a conversation when they're feeling anxious in a social situation. And many of these ideas are really a function of the marketing that's been done by many e-cigarette manufacturers. So using this information about what does Juul use mean to youth and young adults, we established 3 main constructs or message themes around which to actually develop and air advertising executions. We couple these with our principles of talking to youth and young adults, which include refrain from authoritative or directive language. I think those of you who have youth or young adults at home, I'm sure you experience some serious resistance to messages when they're overly directive. So we really try and never to talk down to our audience, but to provide factual information with usually many tones, not just humorous, not just sarcastic, sometimes very serious, but the notion is to have an ongoing conversation with youth and young adults that actually provides factual information in a way that they can understand the information and make informed choices. So here we identify 3 major constructs. Knowledge of health consequences. We really want to increase the amount of information that kids and young adults understand about the health consequences of these products. We want to try and reframe the appeal. I will say that having been in the combustible product context for many years, we had the wind at our back. There was much information in the marketplace about the health consequences of smoking and also the unappealing nature of the product. Here we really have to work to reframe the appeal of this product, particularly in the face of many, many promotional efforts to make this a highly appealing product. And in our efforts to do that, we have to reduce the social acceptability. We have to denorm this product the way we denormed combustible products. So I have to apologize. I was going to show a video of 2 of our executions, but we're not able to do that. So what I want to do is just briefly describe that our findings from survey research, focus groups, and interviews really inform these efforts. And what we actually used was these insights to really develop what we call our Puppets campaign. And they are puppets, as you can see from this photo on the slide. And they deliver the information in a little bit more of an accessible way. And then we sort of give them a lot of factual information that might be a little bit sarcastic in its delivery. They are highly targeted to 15 to 24-year-olds on TV, but primarily on the media that young people are seeing all day, every day. Some examples are Snapchat, YouTube, Facebook, and streaming platforms such as Hulu, just to name a few. In addition to this Puppets campaign, we've partnered with MTV, The Onion, College Humor, BuzzFeed, Adult Swim, and others. And our efforts there focus on integrations of our message into the partners' content, which offers opportunities for us to spread our message to young people with the edge and sarcasm of this age group, which they find humorous and entertaining. I encourage you to take a look at our YouTube channel, Truth Orange, to have a look at more of the Puppets campaign. So I'm really delighted to say that we've had a huge response to our Puppets campaign. This actually reflects our internal message testing before any of the messages are actually aired on media platforms. We look at the response to individual messages using a sample of about 200 participants aged 15 to 24-year-olds, and we're looking to see whether they have receptivity and comprehension of the message, and whether the messages are actually shifting our 3 message construct items by using this anti-vape scale. I'm happy to say that both of these executions were found to be really strong performers, high likability, very relevant to our audience, and perhaps most importantly, generates buzz with strong virality. And really, we found that it effectively reduced intention to vape. So we're very, very pleased by that. So unfortunately, in December, Altria, also known as Philip Morris, bought a significant stake in the Juul company. And when that was announced in December, we quickly put together a suite of messages that were aired on our social channels highlighting the news to help make sure that all the claims from Juul that featured that it wasn't a tobacco company were no longer true. We used the hooking up scene to add humor while conveying some really important factual information that Juul is now part of the tobacco industry, and many of its claims are no longer true. Using an anti-industry approach has been extremely useful for us in helping to denormalize and deglamorize tobacco, and we think that that's going to continue to be an important approach as we move forward. So let me just end with a shout out to a new program that was just developed in response to the significant demand that we've heard from all over the country of adolescents showing signs and symptoms of dependence to e-cigarette products. And to our knowledge, this is the first of its kind, what we call eQuit program. It's called This Is Quitting, and it supports e-cigarette quitters of all ages. And it's also a resource for parents to help their children quit. I can tell you when we published our paper about the prevalence of Juul in our national cohort, I had many, many parents emailing me to understand how best to help their teens as they were struggling through dependence on what is a very effective nicotine delivery device. So it's very easy to sign up. You can text QUIT to 202-804-9884. You can also opt in on our becomeanx.org website, or this is quitting text message platform. And I think it's, using a text platform is a very comfortable platform for youth and young adults, and I hope you find it useful. I'm going to stop there and just provide you with my contact information. If you have any questions or would require any further information, I'm happy to respond. Thank you.
Wow. Thank you, Dr. Vallone. Not only for sharing that new program, but for sharing more about the impactful work that you guys are doing at the Truth Initiative. Now, wasn't that interesting? I'm completely thrilled to learn more about the research that you guys are doing and how these approaches that you've shared are really kind of shaping these prevention strategies. But now, we'd like to dive into the Real Cost campaign with FDA's Emily Diorio. Now, Emily is a health communication specialist like myself with the FDA's Center for Tobacco Products. And for the past 4 years, she has collaborated with scientists and public health experts to inform the development of science-based, attention-grabbing, effective communication materials for at-risk audiences. And for the past 2 years, she has served as the campaign manager for the Real Cost Youth E-Cigarettes Prevention Campaign, which uses mass media to reach teens and help break their cost-free attitude towards vaping. So I am so very excited to hear what you have to share with us, Emily.
Hi, everyone. Thank you for that introduction, and thank you for having me today. As discussed, I'm going to walk you through one of the FDA's programs called the Real Cost. We are, the program that I lead is a youth e-cigarette prevention campaign. So as the previous speakers have talked about, we know that public education is part of the solution. Public education campaigns can prevent and reduce tobacco use on a population scale. And so the FDA Center for Tobacco Products has several campaigns that target different groups of people who use tobacco at higher rates than the general population. One of our campaigns is called the Real Cost, and the goal of the Real Cost is to snap youth out of their cost-free mentality when it comes to tobacco use. So the Real Cost actually started in 2014, and our messages were focused on cigarettes. In 2016, we kind of expanded our umbrella a little bit, and we continued talking about cigarettes, but we also started talking with youth about the risks of smokeless tobacco. And then just this past year, we expanded again, and we are now including messages for teens about the risks of e-cigarette use or vaping. So the previous speakers have really gone over this, so I won't spend too long here, but the latest trends are concerning, as we all know, with vaping, with the most recent surge showing us that more than 3.6 million teens are currently vaping. And we know that there are a lot of things that are contributing to this surge, but part of it is this idea of social media norming. It's really kind of fanning the fire and contributing to this epidemic. So places like Instagram have a lot of teen norming that's going on and being shared. And really, vapes are kind of acting as a social currency among teens. They're reporting that when they're hanging out with friends and that they're at parties, they don't really need to leave. Like they would need to step out to use a cigarette. They don't really need to leave to use their vape. They can do it, right inside with their friends, or even we're hearing anecdotally in schools, in the classroom, and in the bathroom and whatnot. And all of this is really resulting in this perception that using e-cigarettes is a consequence-free and a cool thing to do. We conducted our own research, which really validated this. When we talked with teens in focus groups, we showed them a series of draft ads and statements, and we asked them questions like, is this motivating to you? Is it believable? Do you understand the message? And that gave us a lot of insights into the current teen mindset. What we learned is that teens felt that our messages were really strong when we talked about things like exposure to chemicals in vape aerosol when you inhale, and also things like metal particles that you can inhale from vaping. when we talked to teens about nicotine addiction, what they told us is that they didn't really understand why it was bad to be addicted to vapes if they didn't have any perceived health effects tied with them. So that's not to say that a nicotine message is not effective with teens. It just told us that nicotine addiction can't be our only message when we go out and we talk to teens. And lastly, we tested a series of ads that were focused around flavors, and there was a lot of confusion among the youth. So we didn't end up launching any flavor ads this past round, but we are trying again, and we do think it's a promising message. So we refined some of our messages, and we produced them. And I have a few quotes here from our research that we conducted. I'll just read one of them at the top. I heard that vapes are really not that bad. There aren't any studies that showed otherwise, at least not yet. A lot of people say it's a lot better than smoking. And this was a common mentality that we heard from teens. It's kind of like, I'm going to keep doing this until you give me a really strong reason not to. We also asked teens what they thought about the idea that it's too soon to know what the long-term health effects of vapes are. And the teens in our focus groups told us that wasn't really compelling or motivating to them. They said, give me the facts, give me the hard reasons why I should not be vaping. So we took all of those learnings and we turned them into a series of ads that we launched in September of 2018. We rolled out almost 20 new videos. We launched them on online platforms. As I said, we tested them qualitatively, and then we also conducted a round of quantitative testing with teens just to make sure that they were effective and that there were no unintended consequences with our messages. We employed a media plan that used innovative tactics to reach youth. We also distributed materials for high school bathrooms, and we created what'sinavape.com, which is an interactive website that I encourage you to check out and share with partners that you know who work with youth. So I won't play the videos, but one of our ad series is called Epidemic. There's a YouTube link there that you can watch the ad. And we also surrounded our main ad with a series of things like social media content and web banners, and all of these things kind of penetrated the teens' online environment, and they all drive to our website where teens can really dive into the facts and learn more. We also launched a series of ads that we're calling Brain Troll. Brain Troll has that nicotine message. As I talked about, we didn't feel that just talking about nicotine worked as a standalone message, but when we complement it with other messages, we do think it's a really important one to go out and talk to teens about the addictive nature of vapes. And so as I mentioned, we rolled all these ads out online. We rolled our ads out on age-verified digital media. And this means that they're rolled out on platforms where we can verify that 12 to 17-year-olds, who are our target audience, are able to see the ads, and that there's no spill to anyone who is younger than 12 or older than 17. So it really allows us to hyper-target the age group that we want. On this media plan, we're reaching about 60% of our audience 28 times per quarter, and you can see some examples of the platforms there on the slide. Think places like Instagram, Facebook, Pandora, Spotify, YouTube, Xbox, among others. We also recognize the need and the kind of overwhelming requests that were coming in from school administrators and educators saying we need resources in the school environment. So we partnered with Scholastic, and we created lesson plans, infographic, research activities, and we have been proactively distributing them to educators in schools nationwide. So I've included the link here, and again, I encourage you to share these resources with schools in your area and any other partners you know that work with youth. And lastly, I've included just a couple more resources on this last slide. We do have posters that are available. You can order them, we'll ship them to you for free, or you can download them to your computer and print them yourself. We also have an infographic that has some of the common myths that teens believe about vaping and the facts behind them, and that's available in both English and Spanish. And then we also created an infographic based on the latest NYTS findings, and that's good for adults as well. And that was everything I had. Thank you very much.
Thank you, Emily. Media certainly, as you've stated so well, media certainly plays an important role in addressing teen e-cigarette use. And your presentation has offered lots of examples of media-focused prevention strategies, and I love it. So in addition to what Emily and Donna and Brian have shared, here you can see some timely resources that you may find useful for your e-cigarette prevention work with youth. And now is the part of the webinar that I enjoyed the most, which is we have some time to take a few questions from the audience. And I see with the mass participation that we've had for this webinar that there have been quite a few questions posed in the chat pod. If you still have questions, please type them in. I know that during the presentations, the presenters have been pretty great at looking at the questions in the Q&A section and addressing them in real time, but I am going to take a few that I see in front of me. I'm going to start with a question for Donna. Donna, can you give an example of a reframe appeal? The questioner says, I found that youth do not understand or care what they are doing. Do you have any recommendations in how to better approach it?
That's a really good question. You know, I think that we need to pair something like vaping with things that are not popular among youth. So when you think about smoking, unfortunately, there's a major segment of the audience that never would engage in smoking but are now using vaping. So if you think about some of the things that are not cool, that people really refrain from, I think we have to start framing vaping in the same way we sort of reframe cigarettes. I don't have a very specific example, but things, you know, there are people who say, you know, it's a really stupid thing to do. And that sort of gets back to this issue of health consequences. But we know health consequences is only one of the issues. I mean, you know, people say they don't want to go in bathrooms anymore because the scent of fruit is just makes them feel nauseous. So I think there are ways to talk about this activity like you talk about anything else that's sort of become outmoded, is to really think about what's important to kids right now.
Great, thank you. I see that we have a few or more than a few questions centered around this one, so I'm going to direct this one to Emily. The question is, or the questions have been, what are some signs of e-cigarette use in teens?
Can you clarify the question? What are some signs?
Things to look for. And maybe specifically things to look for parents.
Well, I would encourage the other speakers to jump in as well. I mean, there are signs of nicotine addiction that parents could look for. You know, we say when teens can't go an hour without vaping or thinking about vaping, or if it's the first thing they do when they wake up. I think that was something that someone shared recently that was a good tool, but I think others would probably be better suited to answer that question.
Gotcha.
Yeah, hi. Yeah, this is Donna. So we've heard like high irritability, inability to sleep easily, being woken up at night and needing to drool. I think for parents, knowing what these pods look like, I can tell you we just did a survey, and a very significant portion of parents as well as teachers thought that the Juul pod was a carrier for lead that one uses in a mechanical pencil. So I think there's a lot of information that the public is not aware of, and I think seeing those small pods in your kid's bedroom is a really important indicator.
Here's a question that may be suited for Dr. King, but please, anybody jump in as well. Why are e-cigarettes considered a tobacco product when they don't contain tobacco? Should we focus more on nicotine?
Yeah, sure. So this is Brian. So in the United States in 2009, Congress gave the FDA the authority to regulate tobacco products. And the way they framed that regulation was anything made or derived from tobacco is considered a tobacco product in the U.S. And so all the nicotine that's currently on the U.S. market is derived from the tobacco plant. So they extract it from tobacco using ammonia. And so you can create nicotine in a lab. You can also get it from some other sources, but for the most part, it would be too expensive for it to be marketable for companies. So all the nicotine that's currently on the market is derived from the tobacco plant. And so FDA has regulatory authority over it in the United States as a tobacco product. And so that's why you see the FDA, the CDC, and other federal agencies message around all of these products being tobacco products. There is a mechanism for people to submit applications if they want to advertise an e-cigarette for the purposes of cessation, but at present no one has submitted such applications. So every e-cigarette on the U.S. market is regulated federally as a tobacco product. Keeping in mind, as was noted before, there is some variation in terms of terminology across states and communities in terms of how they define a tobacco product, but at the federal level we consider e-cigarettes to be tobacco products. And we also find that it's easier messaging as well. Remember that we've worked for many decades to denormalize the use of cigarettes, and cigarette has a very negative connotation. And so if we continue to reinforce the harms, as e-cigarettes as a tobacco product, and that there are risks, really helps for a uniform public health message that kids shouldn't be using anything, and that anything when it comes to tobacco products. And so it helps with a uniform message, in terms of getting to key stakeholders. So that's the backstory. But CDC, the Office of the Surgeon General, and all federal agencies in the U.S. Treat these as tobacco products because of that, and that's why in our routine surveillance, including National Youth Tobacco Survey, you're also going to see it included in any tobacco use measure. To the second point, nicotine is certainly the common denominator, so it certainly makes sense in terms of messaging to youth about the risks of nicotine. We know that it's highly addictive, but we also know that it can harm the developing adolescent brain. So in terms of health messaging, focusing on the nicotine certainly makes sense, but in terms of the broader umbrella of what these products are, at least at the federal level, we do it under the broader umbrella of tobacco products and then focus on the variety of harmful ingredients, which also includes nicotine.
Thank you, Dr. King. Here's another question that I've seen 4 or 5 times, so I'm going to pose it to all of you. Can you share additional examples of evidence-based prevention programs? That seems to be a big question in this webinar.
So this is Brian. I'm happy to take that. We ultimately know that prevention is going to be key when it comes to tobacco product use. The considerable gains we've made in reducing smoking over the past several decades has been because of prevention, right? An ounce of prevention is worth a pound of cure. That being said, it's important to consider what we, talk about when, prevention interventions or prevention strategies. And so I assume this message is directed towards specific programs in terms of preventing youth use of these products. But it's important to remember that population-based strategies have been a critical ingredient in our ability to prevent all forms of tobacco product use. 9 out of 10 adult tobacco users begin during adolescence, and so 99% begin by young adulthood. So if we can intervene during that period and stop them from even starting to begin with, that's key. So at the population level, those prevention interventions are going to be those tried and true things that we know work. Increasing tobacco product price, smoke-free policies that include e-cigarettes, mass media campaigns such as the Truth efforts, including leveraging social media, also youth age of sale restrictions, increasing the age of sale of tobacco to 21. So that's the broadest level in terms of the prevention strategies. And then at the sub-national level, you're also going to see efforts related to clinical and education-based efforts. And so examples of that are in schools, implementing a tobacco-free policy and educating teachers about the use of these products and why it's problematic and actually enforcing those policies. In terms of clinicians, prevention policies are making sure that they're aware of the different types of products. They're screening for the use among kids, and they're also warning them about the risk and diverting them to other resources to help them not even start these products to begin with. And then also in coordination, you have to, everything starts at home. And so parents play a key role as well in terms of acknowledging what these products are, knowing the risks, and working with them. So in terms of arming people with tools to effectively accomplish that, there are other resources. The Surgeon General has excellent resources in terms of surgeongeneral.ecigarettes.gov, where you can go and find a variety of different information. The U.S. government also has a teen.smokefree.gov that has a lot of great resources as well, as does the CDC at cdc.gov/tobacco, with a lot of great information that you can use to inform key stakeholders who can work with kids at multiple levels of the continuum to warn them about the risks of these products and prevent them from starting in the first place. The Truth Initiative's new app and resources are great for cessation, and that's a critical component as well. But again, we've got to continue to reinforce this prevention strategy, and it's going to take efforts across the continuum of folks, and everyone serves a role from the parents on up to the federal government, and we can't be remiss if we're going to truly affect and make some impact on this epidemic.
Thank you, Brian. Thank you. I have many questions on how can we address this in the medical community. What role does the medical community play in this issue?
I think that's a really good question. I think that providers are becoming aware of the issue. I think the American Association of Pediatrics is really trying to get out front in terms of this issue. But remember, this is such a new epidemic. We're waiting for a lot of the evidence in terms of the harms associated with this. And so I think the provider organizations are trying to catch up, and we're trying to help educate them on what we know. But I think that providers will really will play a critical role, particularly since we're very concerned about the evidence related to middle school use, which is extremely concerning given that we know the nicotine exposure effects among youth. So I think they're going to play a critical role, and I think if we had some professionals here from the treatment community, they could talk a little bit about that. But I think that's coming.
So Donna, since you jumped in, I have one question that's specific to you, which is the EQuIT program a predetermined algorithm of text, or is it customized for individuals?
It's really, it's very interesting. It is pre-programmed. This is a broad-based effort, so there are thousands of people who are prompting for tips. But it comes customized in that kids think it's for them. Because it's customized to them in a way that responds to their questions appropriately.
Gotcha. Thank you. This is for maybe John or Emily, but anybody else, please feel free to jump in. And the question is, can you share examples of online modules that students can complete around e-cigarette prevention?
I'll have to punt that one to Emily since, it's not really something that comes up in the Synar program.
Gotcha. Or online prevention programs for teens, Emily.
Yeah. I mean, the first thing that comes to mind is something that we created with Scholastic. It's not a full, module-based prevention series, but it is an online research activity that we have been distributing to teachers, and it accompanies a lesson plan that teachers will conduct, and then the students will go off and do their own research activity. So I think I saw this question in relation to school suspension. That is potentially a resource that could be used. Brian or Donna, any others that come to mind?
Yeah, sure. So this is Brian. So the University of Texas at Austin has a great school-based resource. It's called Catch My Breath, and it's for middle and high school students, and you can search it online. I don't know the specific link to it, but it's the University of Texas at Austin, and it has a series of modules and resources specifically focused at kids. And then the folks at Stanford have one as well. And again, I don't have the link handy, but we can also follow up with the group if that would be helpful to give resources. But those are very strong programs that I've personally reviewed and can attest to the scientific rigor. You need to be very careful, though, that you're not using industry originated or funded education prevention programs. So Juul in particular tried to release a program several months back, and they were promptly educated on why that's a bad idea and subsequently decided not to pursue it. But there's also several tobacco industry-fueled tobacco prevention programs. And so I'd really urge folks to make sure that you're using evidence-based and independent resources, because we know a plethora of scientific evidence over several decades that tobacco industry programs are not effective in terms of helping prevent use of youth use of products that they are seeking to make a buck off of. So in terms of the ones that are independent, try that University of Texas one, the Stanford one, and then also the great resources from partners like Truth, as well as the federal government and the smokefreeteen.gov resources.
So Brian, I have one more for you since you've stepped up. A few people have asked, can you review the generations that were mentioned during your presentation?
Yeah, certainly. So there's currently 4 generations of e-cigarettes. E-cigarettes hit the U.S. marketplace around 2007, so they've been around for over a decade now. The first generation, and the first one to kind of hit the market, was the disposable e-cigarette. And that's the same size and shape as a regular cigarette, and basically those are the kind you're going to get at a convenience store or a small gas station. And basically, once the liquid in that device is gone, you just throw it out. And that's why we call it disposable versions. And those also have the lowest level of nicotine yield. And the big tobacco is primarily in that game for many years, although they've transitioned now to more second generation devices, which are the refillable or rechargeable varieties. So the device itself is rechargeable, but you replace the liquid inside it. And so an example of these are like the vape pens or the more mid-sized devices where you just replace the liquid and you can recharge the device. But the user doesn't have as much latitude to put in whatever flavor or nicotine concentration they want. Normally those devices, you buy a pre-designed pod with a specific concentration and put it in the product. The third generation is going to be the larger tank systems, or mods. These are the ones that are shaped like almost an iPhone or even larger, and you see these primarily at vape shops. The more experienced users use these. And you can do tricks and other things, freebasing, you name it, with those products and create large aerosol clouds. Those are going to be the ones you're going to see at vape conventions as well. Those also allow the user the most latitude in terms of modifying the nicotine concentration or the flavors that they would want in the device. Those are also the ones you're going to see that are going to accommodate other psychoactive substances, such as CBD oil and cannabinoids, marijuana, as well as other psychoactive substances. And the fourth generation is the pod mod. And so the Juul devices is one example of that. Smaller, more discreet. They're going to have very high levels of nicotine, and they're going to use nicotine salts, that technology that I talk about. So those things are going to hit like a beast because they can deliver very high levels of nicotine very easily to the user. And so they're sleeker and more efficient at nicotine delivery. And so overall, across these generations, the general theme is that they've gotten better at getting nicotine to the user. And so that's it could be good and it could be bad. So it could be good for adult smokers because if you get a device that can effectively deliver nicotine in an efficient manner and enough nicotine to replace a conventional cigarette, then that could be good, but we don't have science yet showing that that's actually occurring. Most people continue to use both products. But the harm on this end is that if you can administer high levels of nicotine very easily, it's problematic for kids in terms of initiation. And that's what we're seeing in this country with these new pod mod devices in the 4th generation, is that they're hell of a good at delivering nicotine. And that's a concern because we know that it can addict kids and lead them to a lifetime of nicotine and addiction to tobacco use. So that's the Cliff Notes version of the 4 generations. But right now we're dealing with the great-grandbabies. And I'd remind people that it's been evolving over 10 years and it likely won't be the last. So we'll probably see another generation down the road as other newer products continue to enter the marketplace.
Indeed. Thank you, Brian. I'm going to try to squeeze one more question in here before we have to wrap. I think this is more targeted to you, John, but anybody, please chime in. It's a question that says, are there any in-person tobacco cessation programs that any of the presenters can share?
Well, David, it's John. Yes. In terms of the Synar program, we really aren't involved in the cessation piece. However, CDC funds cessation efforts all over the country through its tobacco control program. So this might be one that I would punt to Brian.
Yeah, certainly. So there's a great resource in terms of cessation, and it's smokefree.gov, smokefree.gov, and that's a collaboration between the CDC as well as the National Cancer Institute, and it has a variety of resources, including 24/7 support. You can download apps and other resources, including redirecting people through quit lines. Currently, all 50 U.S. states have a quit line with folks that are qualified to talk to individuals about cessation, and in many cases, you can also get free nicotine replacement therapy as well. Keeping in mind that these are primarily focused towards adults in terms of the evidence-based interventions, although we do know that behavioral therapy is also effective among kids as well. So in terms of resources focused towards kids, teen.smokefree.gov is your best resource. But for broader cessation materials, smokefree.gov is great. And then for CDC-specific materials, if you go to cdc.gov/tips, our CDC's TIPS campaign, which I'm sure you've seen our advertisements. We've been running now for about 8 years that campaign on television and elsewhere, and there's a lot of great resources in terms of promotional materials and advice to help people quit for good, because that's the goal. We don't want people using any tobacco or nicotine-containing product in the long run. And there's evidence-based measures, including nicotine replacement therapy and medications, as well as behavioral counseling, and there's some great resources online to connect folks to those different areas.
Thank you. And thank everyone for your thought-provoking questions. This was a well-attended webinar, but most importantly, I want to give many thanks to our distinguished speakers. I hope that our time with you guys this afternoon has inspired fresh and, more importantly, actionable ideas for addressing teen e-cigarette use in your organizations, in your communities, and in your coalitions. We certainly do hope that you will join us for our next webinar in March as a part of the MPW webinar series. We will be discussing effective prevention strategies and approaches that can help improve understanding between older patients and their healthcare providers regarding opioid use. So please visit the MPW website at www.samhsa.gov/prevention-week to register today. You can also find past webinars archived on our SAMHSA YouTube page and the MPW website. And I do want to remind the over 1,100 people who registered for this webinar that you will receive the slides and the recording of this webinar usually in about 72 hours, and we will mail you the PDF version of the presentation of all of the presenters, since I know that's a big question that we get. I certainly hope that the information that has been provided to you has been valuable. Please tell us what you thought about this webinar by filling out the post-meeting survey that will pop up once this meeting ends, because your feedback is so extremely valuable to us, and it helps us as we plan our future webinars. Thank you for your time, and please have a great rest of the day.
That concludes today's webinar. Thank you for joining. You may now disconnect.